Welcome to the FREEDOM60 Subcutaneous Administration video from RMS Medical Products. Important reminders before you start. You can replay this video as often as you like. Always make sure you have all the supplies you need and that they're the right ones. Always wash your hands thoroughly and use a clean preparation surface. Always check for blood backflow. To ensure a long, trouble-free life for your pump, always start by winding the knob until the black tab is at the end of the track. Never begin an infusion unless you're certain the disc lure is firmly seated in the pump. If your sterile supplies might be contaminated, start again with new supplies. With the support of your clinical care team, you can succeed. Sub-Q administration instructions from the RMS Patient Information Guide. Step 1. Prepare area, lay out supplies. Clean your work area with alcohol or disinfectant soap and water. Verify that you have the correct supplies recommended by your healthcare provider and lay them on a clean surface. Step 2. Wash hands. Wash your hands thoroughly and, if required, put on disposable gloves. Step 3. Fill syringe. Be sure the product is at room temperature before you begin filling the 60 ml syringe with your required dose. Refer to the manufacturer's instructions or ask your provider for more detailed filling instructions. Step 4. Verify tubing and needles. Again, verify that you are using the correct tubing and needles recommended by your healthcare provider and prescribed by your doctor. Step 5. Attach tubing to syringe. Open the packaging that contains your precision flow rate tubing. Remove the sterile cap from the lure disc end of the FREEDOM60 precision flow rate tubing set and connect the tubing to the syringe. Step 6. Attach tubing to needle set. Carefully unfold your high-flow needle set. Remove the sterile caps from the ends of the high-flow needle set and precision tubing set. Connect the sets together, using care not to contaminate the ends. Step 7. Ensure black tab is at the end of the track. Make sure the pump is off and that the black tab inside the Clearview syringe shield is at the end of its track. If the black tab is not at the end of its track, wind the large knob clockwise. Step 8. Load prepared syringe into pump. With syringe gradations facing up, load the syringe and its tubing into the pump. Make sure the lure disc end of the flow rate tubing is fully seated in the pump's nose. Step 9. Priming needle set. Turn the pump switch to on. The black tab will travel down the track until it makes contact with the syringe. To stop flow to the needles, turn the pump off and wind the large knob clockwise until the black tab is clearly not touching the syringe. The goal is to prime or preemptively fill the tubing, but to stop the flow about 2 inches short of the needles. To minimize site irritation, it is recommended to insert the needles dry. Step 10. Inserting needle. Select your infusion sites, cleanse with alcohol, and let dry. Carefully remove the plastic shield from the needle tip without touching the needle. Pinch the skin and insert each needle into subcutaneous tissue. Secure each infusion site with adhesive dressing. Step 11. Check for blood backflow. Remove the syringe from the pump. With the syringe out of the pump, check for blood backflow by gently pulling back on the syringe plunger. Watch to make sure no red or pink appears in the tubing near your sites. If blood backflow does exist, clamp the flow to that site and call your healthcare provider to determine if the dose can be run using the remaining sites. If so, continue. If not, remove all needles, attach a new needle set, and start again from Step 8. Step 12. Begin infusion. Insert the syringe back into the pump and turn the pump on to begin the infusion. Step 13. Upon completing infusion. Once the infusion is complete, turn the pump off. For best results, wait a few minutes after the infusion completes, before you remove your needles. This will allow pressure to equalize at the infusion sites and prevent backflow of your medication. One at a time, hold each needle in place and peel back any adhesive or dressing around it. Remove the needle in a straight motion, opposite the direction it was inserted. Wind the large knob until the black tab is at the end of its track. Remove the syringe. Cleanse each site and cover with a bandage. Discard all sharps and biologics as required. Some things to keep in mind. Infusion with the Freedom60 is safe and simple. Thousands of patients have successfully mastered sub-Q self-administration. No two patients are alike, so work with your care team to personalize your therapy for you. Some site irritation is normal. It should diminish with time. Longer needles usually don't feel any different from short needles. In many cases, they work better and irritate less. With time, you'll discover which sites work best for you.